What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, June 13th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that can be a health threat to you. Let's face it, there are a lot of different viruses out there, and each and every day we're learning something new about these viruses. Today we're going to learn something new about COVID, and we're going to talk about COVID levels. COVID levels in many places around the world right now are on the rise. And of course, H5N1 has been in the news a lot lately. Not going to talk about that today, as we have a lot of COVID news to talk about. But H5N1, hey, it's something we need to watch out for, because cases at dairy farms continue to increase in the United States, and we're slowly but surely filling in those states on the map with new outbreaks and new cases. And yes, there have been human cases this year. Well, guess what? You need a place where you can be informed on all this. That's what we do right here. The news doesn't talk much about these viruses. I do, and I do it each and every day. So if you're new here, subscribe down below. Give these videos a thumbs up. Hit that notification bell. You'll be notified when I do the daily video. Leave your comments down below, and of course, share these videos with anyone you know, and go back and watch our previous videos. You'll see, you'll learn about some of the different studies, you'll learn about COVID level, you'll learn about a lot of different things, and the other viruses. Alright, we have a very busy day of news and data to get through, so let's not waste any time. Let's get into it. Hopefully we can keep this video under 20 minutes. New wastewater data from Spain is not so good right now. You can see these charts. Up, 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 and more up. So yes, wastewater in Spain is going up, and their wastewater, it's actually, their wave, it's actually accelerating at this point, and they're saying estimates are that 6.65% of the population in Spain right now currently has COVID, because wastewater, that's what wastewater is showing. That's what it's indicating, because it's just rising so fast. It is literally going upward, especially in Madrid at this time. And if we come down here, someone did ask about what the hospital situation was there. And we can see Samuel Hurtado BE, who posted this initial thread, did say he does not have much info about the current situation. However, he knows they are now structurally overwhelmed, with waiting lists getting longer, even though we're achieving record numbers of attended patients. So they're actually saying, he's actually saying, the hospital situation, the hospitals are just overwhelmed right now. And it may not all be COVID. You know, long COVID is a thing as well. People go to the ER for long COVID. You know, other things happen. I mean, this is all on top of the daily stuff. Someone falls down. They break their leg. Someone has a heart attack. Someone has a stroke. Someone has a diabetic emergency. Someone has a respiratory emergency. Then you have to add on top of that a pandemic. It's not a good situation for hospitals. Most hospitals around the world prior to COVID already had a issue with capacity, and some countries are better than others, and clearly Spain right now is having issues. Alright, moving on to this. Wasn't certain if I was going to share this, but this needs to be shared. We know what happened in North Carolina. The mask ban, it got passed by the House. It's moving on to the governor of North Carolina, and it's now up to the governor whether they veto it or goes in place. Chances are it's North Carolina. I think it's going to go into place. Well, New York State Governor Kathy Hochul now said on CNN last night that she is considering a ban on masks. I'm not going to go too deep into this. It gets political. We don't like to do that here on this channel. This pandemic should have never been made political. But right now, she is considering that she would put a ban on masks in New York State. This is early in its infant stages. This was just her speaking on CNN. But as we know in the past, she has said a few things during this pandemic, like hospital-acquired infection. Is it for? Is it without? You know the whole deal. And she actually comes with the data. So we'll have to see here if this gets elaborated on. And I assume if she does it, That's going to open the door to so many more states. Personally, I'm very concerned about my state here in Pennsylvania doing it. All right, moving on to our next piece of information. All right, this is a new study, I believe that was out today. Anywho, more COVID-19 patients died in understaffed hospitals, new data reveals. Yeah, this is not good. We're just reading the headline here. You can read the full report yourself. We don't have enough time on video to do that. These videos would be an hour long. Each additional patient in the nurses' workload pre-pandemic was associated with 20% higher odds of in-hospital mortality. And we have seen time and time again. Matter of fact, I am going to probably do a poll that states, if you're a healthcare worker, or if you worked in the healthcare, did you exit the field because of the COVID pandemic or something like that? Because you know what? I have seen in the past a lot of people that either A, took early retirement. I personally know someone who retired early because the pandemic was, you know what? Enough was enough. I can afford it. I'm out of here. Healthcare has gotten too crazy. A lot of people are feeling that way. They're looking to change careers because they just can't handle the stress of wave after wave of COVID with the people just continuously showing up. Their ER continuously being filled. It's just utterly ridiculous. All right, let's shift gears. Let's talk about someone we've talked about so many times. Bruce Springsteen. Here we go. So he recovers from something. What does he do? Rather than saying, all right, I think it's time I retire. I learned my lesson. Oh, no. Bruce Springsteen returns to the road after illness, set list, videos, blah, blah, blah. Bruce Springsteen's going back on the road once again. And guess where he's doing it? Oh, my. I'm just realizing this. Bruce Springsteen rolled back into action in Spain on Wednesday night after being forced to postpone some dates on his current European tour. Can we reverse for a second? What did we just open this video with? Spain is rapidly going up. So guess what? There's a chance. I'm not saying it's going to happen. There's a chance Bruce Springsteen gets COVID yet again. Spain, I mean, look at these charts. Look at this. This chart for Spain is rapidly going up, and Bruce Springsteen is going to open up yet another show. I guess he just does not want to learn his lesson. Ugh. All right, moving on to this. Long COVID finally gets a universal definition. The new description includes more than 200 symptoms and doesn't put limits on when they start. This is a really good thing. This could be the starting of making things easier for people when they go to the doctor. So many people go to the doctor and say, you know, I'm starting to have these issues that just started occurring, and some people think it's from COVID. Some people don't think it. Most people in the COVID conscious world know that their new issues probably come from COVID. And a lot of people go and the doctors say, oh no, it can't be from COVID. You had that so long ago. Well, with this new definition that's coming on, guess what? It doesn't matter when you had COVID. They could possibly create a link, and you know what? Unfortunately, there are still some doctors in this day, and I'm not trying to discredit the medical industry, the doctors, the great work they do, but unfortunately, there are some out there that do not want to keep up with the times and read any of the latest studies that show all the different things that COVID can do. I myself am a victim of going to a doctor that says, oh no, that issue can't be from COVID. It was a GI specialist. So, yeah. All right, moving on now. Let's move over to Ohio, and then we have to talk about the UK. In Ohio this week, weekly COVID-19 cases stay above the 1,000 mark. Coronavirus update. This is as of Thursday, June 13th, 2024. And yet again this week, Ohio's cases increased from 1,126 last week to 1,370 this week. Remember, a few weeks ago, they dropped a little bit. Some people thought, oh, well, good signs, Ohio's starting to drop. Well, they rose last week, and they're rising again this week. See, sometimes it's like hills. It's not always going to be up, down, and that's the end of the wave. Sometimes it just snakes along. And that seems to be the case of what's happening not only here in Ohio, but in many different places. All right, it's the second week that they've had cases go up. And if we come down here, let's see, there were 53 new people in Ohio that were hospitalized in the past week. Remember, they don't keep an active count of how many are in the hospital. They just keep a pandemic total, which is 151, 600. 161 people that have been hospitalized since the pandemic started, and they did add 3 additional deaths. Alright, moving on to the UK. I do need to backtrack this. Here we go. Weekly cases for the UK. They're up ever so slightly. Again, we're talking about hills. UK just did one. They went down a little bit. Now they're going up a little bit again. Not up a lot, but just up a little bit. 225 cases higher than the previous week. That totals to 1,862. Now, we have to take a look at something else. Healthcare situation, you're saying. Oh, it's down 8.8%. It's down by 151. Patients admitted, 1,567. Yes, on the cover, that does look good, but let's take a look at something else here. That's, okay, we'll say that is slightly good, but there's something else I wanted to show you, and here it is. Here's hospital admissions. You can see, they did start dropping, but mind you, this has not updated for many weeks, so it was starting to drop. But what else just happened? Cases went up slightly. We'll take a look here. If we look at the end of the chart, it would appear to me they're not dropping anymore. It would appear to me they are starting to show signs of leveling, and maybe they're going to go back up, and if they do, that's not good. We're back in that 2022 type pattern where, you know, things go down from the winter wave, then they level off, then they have one wave and go up, then it drops a little bit, then it goes up again. Hopefully that's not going to be what happens around the world or here in the U.S. as well, but early indications, UK may be heading that way. We'll have to see. Things could change next week and they could start dropping again for cases and hospitalizations. We'll just have to wait and see. What we do know is the KP.3 variant in the UK is rapidly increasing. So that could be what's causing the new rise once again in cases for the UK. Alright, moving on back to the US, we do have a bunch of things to look at. National allergy map. 55% of the country is in the medium status. Orange has gotten a little more widespread in the Northeast today. New York State, all of Vermont's in orange. New Hampshire, Massachusetts, portions of Connecticut, Pennsylvania, Ohio, and then the West Coast. Again, the usual spots. Look at Oregon. Red, once again, oh so bad year for Oregon. You could really use a nice rainstorm to cleanse the atmosphere. Unfortunately, I don't have in my forecast for today a big rainstorm. There are just a couple of showers over the next week. That's all that you're going to see. Taking a look at air qualities, if it loads, it was frozen for me earlier when I tried to load it. What I can tell you is here in the Midland, from New York City down to about Philadelphia, there are some bad air qualities today, and I suspect they have not gotten any better this evening. Yeah, take a look at this. Much of the East Coast is dealing with bad air qualities today. The Pacific Northwest, though your allergies are bad, your air qualities are not terrible today. Taking a look at California, a lot of yellow is showing up there, and Texas and the Gulf Coast region. You're also seeing yellow and orange as well. Heat-related illnesses. This dashboard is going to continue to fill in, and I suspect as we head to the end of the month and into July, we're going to see a lot of places that are above average for heat-related illnesses, especially in the East. Want to learn more about all this? You can follow my X account, Climate Data Report, where I talk about climate and weather. And of course, you can head over to my Climate Data Report YouTube channel, where I also talk about weather and climate. I did just post today's video. I know, we don't get a lot of views on that channel, but hey, we never did in the early days of this channel, and look where we are now. So who knows what will happen down the line, but we do talk about an expected heat wave over on that channel. All right, in Philadelphia yesterday, there were 811 EMS incidents. I suspect this is probably, though this is busy, I suspect next week, because we're going to be in that heat as well, next week is going to be really busy for EMS calls in Philadelphia. Anyone who has long COVID now with breathing difficulties, the heat is really going to be, it's going to be a burden on you. It's going to impact your lungs. If you get tired really easily post-COVID, it's also going to affect you. Heat exhaustion, it's more common now in people who have long COVID. I know in the first couple years when I first had long COVID, before I got any types of treatments. Man, those hot days, they really hit me hard, much harder than they did before having COVID. Doing a live looking at what's going on in Montgomery County, Pennsylvania, I'm seeing cardiac arrest in Springfield Township. I'm seeing stroke, cardiac emergency, respiratory emergency. There's some calls to be had. 11 right now, and a live look in at Chester County, Pennsylvania. Not too many calls. We do see some sick person calls and a stroke, hypertension. So yes, there are some calls to be had right now. Sticking with Pennsylvania for just a moment, I wanted to show you this. There are some, they do update twice a week, Tuesdays and Thursdays. Our wastewater page gets update. Still seeing a large increase in Abington, Montgomery County. That's not good. That's not far away from here. I'm concerned about that. Center County, Pennsylvania. One of the wastewater sites there is starting to see an increase, and there is also an increase starting to show on in Indiana County as well. So things are starting to increase, and we're not seeing many decreases. We're seeing more no changes showing up, which means more sites may start to rise once again soon. Walgreens this week. Walgreens, the positivity rate is 27.1%. The prior week is 22.9%. Difference of up 4.2%. Total test 4,213. The prior week was 3,512. Taking a look at Canadian wastewater today. 11 of the sites in Canada are rising. 35 have no change. 16 show a decrease. 0 sites. We're back to 0 sites that are at high. 2 are at moderate levels of COVID. 21 are low, and 39 sites are new. It always says 39 for new sites. All right, moving over to some CDC data, and we're just going to skip right over to the variant data, if it comes up here. KP.3 is 25% of the cases. KP.2 is at 22.5%. LB.1 is at 14.9%. And real quickly, looking at epidemic growth status, all this is going to update tomorrow, hopefully, unless the CDC does a surprise change on us. But you can see it's growing and likely growing in many places. We'll see this map look different in tomorrow's update. All right, taking a look at New Jersey. Hospitalizations. Remember yesterday they went up to 200? Today they dropped a bit to 177. 11 people are on a ventilator. In the ICU, 21. Discharges, 41 at this time. All right, drum roll please. New York State. New York State did have a bit higher case amount today. Why? Because on Thursdays, New York City does their update. Now, I did say I would get their dashboard up, and I did look at their dashboard. Quite frankly, we don't have enough time in this video to show their dashboard today, because we still have a couple other states to show after this. So 1,219 new cases in New York State today. It does look like New York City, though, they were rising. Maybe they leveled off a little bit, but again, it could be like that snaking pattern where it goes up, down, who knows? We'll have to wait and see what happens. Taking a look at hospitalizations, New York State hospitalizations did not increase today, but this little trend I've been watching with the ICU situation, back on June 3rd, or actually no, let's go back to, let's go back to May 31st. They had 37 people in the ICU. Fast forward to today, it's gone up every day since, or at least every reported day since. It's now up to 61. 557 people in the hospital. That is down from 565. Taking a look now at what is going on in Colorado. Colorado does report today that they did have an increase in the number of people in the hospital. 96 people are hospitalized. That's 14 higher than 82 last week. Emergency department visits for COVID are now up to 0.7% of the people showing up to the ER. That's up by 0.1%. Cases this week, 900. That is up by 115, though the positivity rate dropped a bit, so maybe more people got tested. 6.2% positivity rate. That is down by 1.6%. That is a little bit of an encouraging sign, but not good to see hospitalizations up, even though it is still below 100. Could go back below over 100 next week. Taking a look at Washington State now. COVID emergency department visits are up 11%, down 25% for influenza, RSV 0%, and percent of hospital admissions for COVID. That is 1%. And the percent change from the previous week, that is 0% for all three. And the average number of ICU beds occupied, this has increased significantly. It's now at 16 for COVID. That's up by 6. Influenza, no one. It's down by 1. RSV data is not collected. I don't know why they don't collect data for RSV. They never have since we started looking at this. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. Whew. That was a lot of information, news, and data to get out today within our 20-minute period. If you like this video, give it a thumbs up. Want to see more content like this? Subscribe down below. Share these videos with anyone you know. Leave these comments down below. And of course, hit that notification bell. And remember, my website, datareport.info. It is an archive of information to help keep you informed and safe. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Thursday evening. Thanks for watching.